Social Security was enacted in 1935, born out of the Great Depression. At that time, over half of America's seniors were financially insecure. In signing the Social Security Act, President Franklin Roosevelt called it a law that will take care of human needs. It remains as the only retirement income that you can't outlive. In 1940, Ida Mae Fuller was the first American to collect Social Security. Her first check was for $22.54. 30 years later, on July 30th, 1965, President Lyndon Johnson signed the bill creating the Medicare program. After nearly 50 years of discussion and debate on national health insurance, President Johnson presented the first Medicare card to former President Harry Truman in recognition of his efforts to establish the Medicare program. Today, Medicare provides health coverage for over 57 million Americans. That's 18% of the entire population. Taken together, Social Security and Medicare account for 42% of federal government spending. To try to understand more about Social Security and Medicare, I've invited two experts on the topic into the studio. Ann Clifton is the Public Affairs Specialist in the local office of the Social Security Administration, and Adrienne Franklin is the SHIP Coordinator at the Aging Commission. The questions I'll be asking come from a list of the most frequently asked questions by you, the public. I want to start with a very basic question about both Medicare and Social Security, because I have found that people get confused about the age eligibility for both programs. Let's start with Medicare. At what age do you become eligible for Medicare?
You're eligible at age 65. The only difference is if you've been receiving Social Security disability for at least 2 years, then you can be younger. But everyone else, it's 65.
65 period. No, okay, all right. And just very quickly, two things. First of all, as someone is approaching that age, does Medicare contact them?
No, they need to contact Social Security at least 3 months before their birth month so they can get signed up, because in most cases you have to enroll yourself into Medicare.
Okay. And just give me the basics of the 4 parts of Medicare. What are they?
The 4 parts of Medicare, we have A, B, C, and D. A is your hospital insurance. B is your medical insurance, so doctors and outpatient services. We'll skip C for right now. D is your prescription drug coverage, and so all of that is on one side. C is by itself. That's where you get A, B, and D together, and that's called Medicare Advantage Plan.
And Medicare Advantage Plan, if I'm saying this right, is essentially sold through private insurers, correct?
Yes, although they are contracted with Medicare.
So it is Medicare.
Yes.
But it's just you're buying it from somebody else as opposed to the government.
Right.
Okay, all right. Well, that's not too complicated. All right. I know this is a loaded question for you, but what is the age eligibility to receive Social Security benefits?
Well, the earliest you can file is age 62. That's still the same. The only difference is if you want to get full benefits at your full retirement age, that varies based on your birth year. So most individuals who are filing right now were born between 43 and 54, so their full retirement age is 66. Anything after 1954, it goes up by 2-month increments until you get to 1967 birth year, in which you have to be age 60.
And when do you have to take those benefits?
You don't have to take those benefits. It's your choice. It's a private choice. We can't make that decision for you. What we can do is provide the tools for you to help
But at
make
age
that
70, you do.
At age 70, that's the last time that you can receive any delayed retirement credits. So anything beyond that, you're not going to get anything additional if you waited that long.
Okay. Let's go into some of the questions that you get most frequently in your offices. We'll start with Medicare. First of all, when do you sign up? And particularly, do you have to wait until you're retired to sign up for Medicare?
That's a good question, and I get that all of the time. So, no, you do not have to wait until you're retired. If you want to sign up for Medicare based on your age, you have a 7-month window. So, the 3 months before your birth month, as well as the 3 months after. So, that 7-month span. So, for instance, my birthday is in January. If anyone wants to send me a gift. So, my 3-month period would start in October, and it would run all the way through April. And that's when I could sign up and not have any penalties for my Medicare A and B.
So you need to pay attention to that window of opportunity
Yes.
there that you have.
Yes.
All right. Let's talk about Social Security. How can you get a document that shows your lifetime record of earnings and an estimate of what your future benefit might be?
A great question. The Social Security statement, you can obtain it through the My Social Security portal, which is a free online portal that allows you to look at your information. You can sign up for that, or you can contact us and we can actually mail it out to you. If you're age 60 or older, we automatically mail it out to you.
I was about to ask this because I know I receive them automatically. Yeah, okay, all right. During the season, we are bombarded on television by commercials talking about Medicare open enrollment. Open enrollment. What is open enrollment?
Open enrollment is the period in the fall from October 15th through December 7th. During that period, you can make changes to your Medicare prescription drug coverage. So if you have Medicare Part D, you can join a plan, you can switch plans, you can drop a plan. If you have a Medicare Advantage plan, which we call Part C, you can also make changes because in most cases that includes your prescription drug coverage. So again, that's from October 15th through December 7th of every year. And we encourage everyone to at least check their coverage to see if it's going to be the best one going forward.
If I lose my Social Security card, how do I get one, a replacement?
Well, knowing your number is the most important thing. You don't have to actually replace it unless you need it. But the quickest and fastest way is through the My Social Security portal. And actually, Tennessee just was one of the states recently that has added that. Locally, Tennessee, Mississippi, and Arkansas are states that you can obtain that online, or you can visit one of our offices, or you can mail it in.
Can you get a new number?
We don't recommend a new number because obviously your Social Security number is attached to your earnings and that sort of thing. If there is an identity theft issue, then you would want to contact the Federal Trade Commission. They're the ones that actually handle that. So we don't routinely change a Social Security number.
I was just curious because identity theft seems so widespread these days, and everybody wants to scam you out of your Social Security number. So, on Medicare, you talked a little bit about this with the Advantage plan, but is dental and vision coverage part of original Medicare?
Original Medicare, no. So if you have original Medicare, you're going to need to seek some form of insurance elsewhere. But with
when you talk about original Medicare, you're talking about what?
Original Medicare is when you have your Part A and your Part B through the government itself. So they are your insurance company. And then you have that separate Part D for your drugs. So that's original Medicare. And in that case, there is no coverage for dental, vision, or hearing. Now, through a Medicare Advantage plan, you do have that coverage, and it's going to vary depending on the plan that you select.
Again, because they're from a private insurer.
Right.
So they're going to give you some different options.
Yes.
All right. Okay. What if I need to make an appointment with your Social Security office? How do I go about doing that?
You can call our 1-800 number at 1-800-772-1213, or you can contact your local office to set up an appointment. But you don't have to have an appointment to come in. We do have walk-in service, but keep in mind if you have an appointment, obviously you're going to be seen first.
Yeah. Okay. On Medicare, Medicare, correct me if I'm wrong, original Medicare covers 80% of the cost, right?
Right, for your Part B, it's a little different with Part A, but with your medical costs, original Medicare is going to cover 80% of Medicare covered services.
Which leaves 20% left over.
Yes.
Which is an individual's responsibility, which brings in the supplemental plans, or sometimes called Medigap plans.
Right.
Talk about those.
Okay, so supplemental insurance, also known as Medigap, that's optional insurance, so you're not required to take it. There's no penalty for not taking it. But if you do choose to get it, it's sold by private companies, and those are not contracted with Medicare, so you would definitely need to contact the companies themselves in order to get enrolled. But those are plans that you can get to cover some or all, depending on which plan you choose, of your co-pays and deductibles that are not covered for Part A and for Part B.
All right. I just moved not too long ago. I had to do this. So how do you go about changing your address?
If you're receiving Social Security benefits, you can change your address through the My Social Security portal, or you can call us. If you're receiving supplemental security income, you would need to contact your local office so that we can get that changed for you.
And as long as we're talking about change of address, what about Medicare and change of address?
With Medicare, we actually encourage everyone to contact Social Security because that's going to govern the address for Medicare. If they contact Medicare, it may not actually get back to Social Security. So I would say contact Social Security.
Let's talk more about Medicare. What is a deductible? Because you do have deductibles in Part B, correct?
Yes.
And Part D for that matter, correct?
And even in Part A. So your deductible is the amount that you have to pay out of pocket before Medicare covers your services. And a lot of people are confused by that because the deductibles do vary depending on what part we're discussing. For Part A, it's $1,364 in 2019, and it actually is not annual. It's per benefit period, per 60-day benefit period. For Part B, it's a little easier, not only in price, but also is that it's annual. So Part B is an annual deductible of $185. So once you meet that, that's when they pick up their 80% and you're left with that 20, you or your Medigap plan. And then for Part D, the companies will vary in the deductibles. There are some with no deductible, but the maximum for 2019 is $415. And so in that case, especially when it comes to your prescriptions, you're not going to pay that up front, of course, because some people are afraid of that. Oh my goodness. No, what that simply means is whatever prescriptions you need to get, you're just going to pay the deductible price until you hit whatever your deductible is. Once that happens, that's when you start receiving those discounts.
Let's talk about cases involving married couples, spousal benefits and so forth. What is the eligibility for Social Security spouse benefits versus and my own retirement benefits?
A spouse can receive as early as age 62. However, whomever they're married to has to also be receiving benefits. Now, in a divorced spouse situation, it's a little different. They both have to be age 62, be married for at least 10 years, and the other kicker for both spouses and ex-spouses, half their benefit, the most they could receive as a spouse is half of what the spouse receives, but their benefit has to be less than that. So in order to qualify, they have to have a lower benefit in order to qualify as a spouse.
A little confusing.
Yeah, it is. It can be. It can be. Basically, the thing is, if they are eligible for spouse's benefits, but they're also eligible on their own, they need to file on their own first. And then if there's anything additional to be paid on the spouse's benefit, we would pay them.
We can file from that, okay. All right. Can I keep my doctor with Medicare?
If you are on original Medicare, as long as your doctor accepts Medicare insurance, yes, you can see any provider that accepts Medicare. Now, if you have a Medicare Advantage plan, also known as Part C, that's when you want to make sure that your doctor is in network, because if not, you may incur other charges. In some cases, you may incur all of the cost.
The Advantage plans, I take it, they function a little more like HMOs?
Yes, well, there are about 3 different varieties, but the 2 most common are HMOs and PPOs. So with the HMO, you definitely have to be in network or else you don't have coverage. With the PPO, as we're familiar with our employer insurance, you have a bit more flexibility. You may be able to go out of network and still be covered by Medicare. However, you would have a higher coinsurance.
A lot of things are done online. We've already talked about online already, but with Social Security, there's a thing called My Social Security. How do you create an account, and what can I do with that?
Sure. If you're not receiving benefits, you can view your statement, the one that we used to mail out every year, but it gives you the ability to view it any time. It also gives you estimates for retirement, disability, and survivor's benefits. But the way to sign up is you visit our website at socialsecurity.gov and just look for My Social Security and create an account. It's going to ask you some questions to verify that you are who you are, and then you can set that up. You just have to be age 18 or older, have a valid email address, and a U.S. mailing address. But it gives you access to a lot of different things. Now, if you are receiving benefits, you can actually change your information, update your address, direct deposit. You can also request a replacement Medicare card, Social Security card, and get proof of the benefits that you're receiving.
All right, on Medicare, what if you already have insurance and you reach age 65? Do you have to then take Medicare?
That depends on the type of insurance you have. So if you have insurance through active employment, so you're employed or maybe your spouse is actively employed and you have insurance, then in most cases, no, you don't have to take Medicare. If your employer has more than 20 employees, I do caution people to always speak with their benefits administrator, because some companies may have their own particular rules. But generally speaking, if you're working for a company or your spouse is more than 20 employees, you probably can delay taking Medicare. Now, if you have retirement insurance, that's kind of a little bit different. When it comes to retirement insurance for medical, unfortunately, Medicare does not consider that creditable insurance, so it would be best to go ahead and take Medicare Part B. So that you don't have any penalties later. So again, it depends on what type of insurance you have.
Are Social Security benefits taxable?
Yes.
How do I get the necessary IRS form to tell me how much I owe?
Well, that is really dependent on what you feel that you need to have withheld. There is a form that you can complete. It's a W-4V. And what it does is you can withhold different increments set by the IRS every year, and it can withhold your taxes because it is a voluntary withholding, not voluntary to pay, but voluntary to withhold. So you just can ask for that initially when you first file, or anytime after that. You can also start and stop it because, again, it's voluntary.
If I don't take prescriptions, or if I take very few prescriptions and they aren't expensive, let's say, do I have to get a Medicare Part D plan, the drug plan?
It's not so much that it's a requirement like they're going to come and get you if you don't. However,
the Medicare police are going to get
yes. However, if you delay taking Medicare Part D and you don't have creditable coverage elsewhere, then you could face penalties when you do finally sign up. For example, there was a lady who, bless her, 92 years old, never needed prescriptions, so she never signed up for Part D. But now starting to need prescriptions, so looking into it, they're going to calculate a penalty based on how many months you went without creditable insurance, whether it's through Medicare or otherwise. And those penalties can start to add up if it's been a long period of time. So that's why I encourage even those who perfectly healthy, don't take anything except maybe vitamin C every now and again, you might look into maybe just getting a low monthly premium Part D plan so you can avoid that later.
So you kind of have to have it, but you don't really have to have it.
Right.
Is that the answer to the question?
It's like car insurance. You have it just in case. You don't have it because you're going to have an
It's a
accident.
just in case. I tell people, you may be perfectly healthy, but suppose this is the year you get bronchitis.
Right.
True.
Then you might want it for that purpose.
What happens if I work and I'm already receiving Social Security benefits?
Well, if you're under your full retirement age 62 or under your full retirement age, then the most you can earn in 2019 is $17,640. Anything over that, we hold $1 for every two that you're over. If you're in your full retirement age year, you can earn up to $46,920. But once you become your full retirement age, you can earn any amount.
Yeah, you can work all you want.
You can work all you want.
Still get your Social Security.
You will still get your Social Security, but it could put you in a different tax bracket. So we always tell people just be aware of that.
That's another department. We won't talk about that right now. All right, we talked about Medicare Advantage plans, but one more time, just if you have an Advantage plan, is it still Medicare? Because it's through a private insurer.
Right, yes, it is definitely still Medicare. I tell folks, Medicare Advantage plan, you see that first word? You've got Medicare. And I think what happens is, because they're told that you want to make sure that you use the card that the plan sends you and not your red, white, and blue card that you get from the government, that can be confusing and make people think, oh, well, that was Medicare, I don't need it, I have something else. And so I tell people it's still Medicare, but it is operated by this private company. And that's why put your red, white, and blue card in a safe place, in case you need it later, and go ahead and use that card from that plan. But it is definitely still Medicare.
Okay. Let's talk about scams, because they affect both of your agencies. What should a person do if they get a call or an email or a text from someone saying they're from Social Security Administration? What should they do?
Well, keep in mind, we do not usually make random calls unless you have some pre-existing business with us anyway. So the best thing to do is don't give out private information, And if you do get a suspicious call, you can actually report it to our OIG, which is the Office of Inspector General. And their number is at 1-800-269-0271. I have to kind of do a little cheat sheet here. And you can also report it on their website at oig.ssa.gov/report.
And can I, if I get a questionable email, text message, phone call, can I just call the local office and say, have you guys been trying to contact me?
Sure, you can call our 1-800 number, that 1-800-772-1213, or contact your local office, and we can verify.
Now, you mentioned, we talked specifically about phone calls there, that generally, almost always, Social Security is not going to contact you first unless you've contacted them by phone. Does that hold true for text messages and emails?
Exactly, same thing.
Same thing.
Now, if you have a My Social Security account, we do send you an annual reminder to check your statement every year around your birthday, but that really is the only time. But if you are suspicious, don't click on any links or anything. Be sure to contact us and we can verify if it was legitimate.
Yeah, don't click on that email that says, we're from Social Security. We forgot your Social Security number. Could you please update us?
We would never ask you for that.
No. Now, what about the same scam question for Medicare?
Yes, if you receive any calls, Medicare is not going to call you again unless you had put in a call to them and asked for a call back. They will always contact you by mail. And then also similarly with Tennessee SHIP, which is where I work, we only call you if you call us first. So if you don't recall getting a call from SHIP or that you left a callback number with Medicare, just don't answer it. If you feel uncomfortable, call 1-800-MEDICARE, or you can call SHIP at 877-801-0044 and verify, were you all trying to contact me, and find out. Otherwise, I tell people just hang up the phone.
Tell us what SHIP SHIP stands for.
It stands for State Health Insurance Assistance Program. That's right, we left the A out because it ruins the logo of the boat. So, State Health Insurance Assistance Program, and we assist you with your Medicare questions, and also if you have any concerns about fraud and abuse, we're partnered with SMP, which is Senior Medicare Patrol, so you can give us a call, and as she mentioned, the Office of Inspector General can look into that information, any type of scams, fraud, or errors that you feel is happening.
And also, this gets me to the next question that is asked. How can I get help paying for prescriptions or Medicare premiums?
Yes, you can get help with your Medicare Part B premiums if you have a certain income, also with your Medicare Part D premiums and copays if you meet a certain income. So if you're not sure what that income is, again, call SHIP, 877-801-0044, and we can assist you. We can do applications over the phone or in person. And if you need help with your Part D, that's actually a program called Low Income Subsidy operated by Social Security. You can contact them for that. You can contact us. We're happy to help with that and be a mediary and assist you with that online application.
Lastly, let's talk about the Social Security website. Because most boomers now are pretty internet savvy, I would say, computer savvy. What can you do on the Social Security website?
Well, the most convenient thing that you can do is file for benefits. You can file for retirement, disability, and supplemental security income online. Now, you can also get your statement online. The My Social Security portal is just a unique way that you can get that information for free without having to contact us. It's just another service option.
All right, well, I want to thank both of you for coming in and answering some of the most frequently asked questions that people have. So hopefully we cleared up a few things. Thank you very much for being on The Best Times.
Thanks for having us.
To get your Social Security or Medicare questions answered, call one of these numbers or visit their websites.